Welcome everybody, and thanks very much for coming along to this information session about the Master of Health Data Analytics, which is a new master's degree that we're very excited about and very happy to share information about it with you. So my name is Andrew Forbes, and also with me on this session is Dr. Joanna Dipnels. We're both in the School of Public Health and Preventive Medicine at Monash. So I'll just do a very brief introduction of myself, and then I'll hand over to Joe, and we're co-coordinators of the unit. Just a couple of notes about the session. If you have questions during the session, please pop them into the chat, and we'll have plenty of opportunity at the end of this presentation that we're doing to have a sort of live question and answer. Also, if you could please keep your microphones on mute, the usual Zoom practices, and just for interest of bandwidth, keep your video turned off. But when you ask a question later on, you feel free to turn the video back on. So just a brief introduction about myself, and then I'll hand over to Joe to start off the presentation. So I'm a professor of biostatistics, so I head the biostatistics unit, and I coordinate the Master of Biostatistics degree at Monash. And Joe and I have co-developed this Master of Health Data Analytics degree, and we're co-coordinating it. So I'm coordinator of this other master's degree, and so I've got a very good understanding, clearly, obviously, of the difference between the health data analytics and the biostatistics degrees, and distinctions are quite sharp, and we'll come back to that later. So I'll hand over to Joe now to do a brief introduction and then do the initial part of the presentation. So thanks, Joe.
Thanks, Andrew. Well, first of all, just to give you my current role, I'm a research fellow and statistician with the Pre-Hospital Emergency and Trauma Research Unit. I collaborate with the Faculty of IT on numerous projects using machine learning with health data, predominantly in the area of injury research. And so this new course is really exciting, and I'm really looking forward to presenting what it's all about. I'm just going to turn off my video because I live in Gippsland, and so therefore my internet can be a little bit dodgy. So we're going to talk about some background to the Master of Health Data Analytics, what it's about, and then summarise. Just to give you an understanding of why I'm really excited about this new master's course. After university quite a few years ago, I started my career in the commercial world and then went back to academia to do a PhD in 2014, where I developed a risk index for depression using machine learning methods. Just 7 years ago, this was really new. But since then, I have seen a phenomenal explosion in the application of machine learning and all that is machine learning to health issues. I predict there is going to be a tsunami of health data coming our way in the next few years, and there needs to be health data analysts there to meet these demands. Now, SEEK have predicted, which is probably people know is where that, you go for looking for jobs, has predicted a 28% increase in job advertisements over the next 5 years for data analysts. I did a quick look at SEEK on October the 4th, and I just plucked out a few of these just to give you an idea. Telstra Health were looking for a lead data scientist, healthcare analytics and AI in Sydney. Western Health, we're looking for a data scientist in Melbourne. These are just a few. And Health System Support Group, we're looking for a senior manager data analytics in Sydney, and there's some idea of the range of the salary they were looking for. So what are the drivers making this type of career attractive to new entrants? Well, there's a COVID pandemic, COVID and everything COVID. For example, the University of Cambridge Andrew, can you just turn off your mic?
Oh, I'm sorry.
So the University of Cambridge published a research article in Nature Medicine outlining their use of artificial intelligence to predict COVID patients' oxygen needs on a global scale. Now, they used what was termed federated learning to analyse chest x-rays and electronic health records from hospital patients with COVID symptoms. So there's just a little snippet of, in the academic world. Google DeepMind Health, they're currently assisting researchers to develop algorithms to detect differences between healthy and cancerous tissues and to improve radiation treatment. So if Google are looking in this area, it's on the move. We all know that. In our everyday life, health apps tailor our personal requirements, and that they're proliferating. Dare I say, for the weight loss apps such as Noom and MyFitnessPal, there are numerous more. They're tailoring it to your needs for weight loss. In January 2018, that was 2018, the McKinsey Global Institute stated that workers will need to acquire new skills. As machines increasingly complement human labour in the workforce, we will need to adjust to reap the benefits. This graph is from this article, and it shows artificial intelligence and its potential to create value across sectors. And if we have a look at the healthcare systems and service sector, we can see it's roughly in the top 5 for AI impact in billions of dollars. And if we have a look at the share of AI impact on total impact derived from analytics as a percentage, we can see that it's in the same basket as consumer product goods, banking, media and entertainment, and aerospace and defence. That was in 2018. So there is a great opportunity to acquire the skills for future jobs security in health data analytics. So the need for health data analysts is real, and it's growing day by day. It's needed by private health funds, such as Medibank Private, hospital services, government health departments. Our unit work with a Department of Health, the Victorian Department of Health, and we're using large databases, and I've been using machine learning methods there. And that, segues into academia, but in private enterprise as well. And this AI Health, this is a commercial Australian group called AI Health, and they state that they are Australia's first artificial intelligence company specialising in gathering, exchanging and coordinating vital data that underpins the future of the innovative health sector. Everything health. Now, Monash recognised this emerging need to upskill graduates and decided to design a new and innovative Master of Health Data Analytics course. This course is suitable for recent undergraduates wishing to seek a career in health analytics, graduates of health-related degrees, maths and statistics degrees, and obviously of computer science and IT degrees. It's also suitable for health researchers or practitioners that are basically looking to enhance their quantitative skills, even change their professional direction. And it's also very suitable for data scientists who are wanting to enter and specialise that very innovative and growing health domain. So, I've found that the world no longer is a world of silos where you have to specialise just in one area, one stream. I've got a background in econometrics and statistics, but I work with IT and use machine learning as well. So the Master of Health Data Analytics takes a core program structure similar to the Master of Data Science and the Master of Business Analytics, but we're adding that health focus. that important, necessary health focus. The core program structure is similar to the Master of Biostatistics, and Andrew can expand on that if necessary, but with greater data science and analytics focus. And there's more quantitative elements to it than the Master of Public Health. This course will allow you to select targeted elective units. So you take the key aspects of each of these individual master's programs that I've just mentioned, and we add that health analytics focus, and we get the Master of Health Data Analytics. So let's look a bit more detail about this course. The Master of Health Data Analytics is a postgraduate award. Graduates will develop knowledge and skills across health and analytics. The topics that will be covered in the health area, we're looking at health systems, health data sources, things like medical benefits scheme, different registries, human body systems, epidemiological principles, linked health data, a growing area. In the area of analytics, topics will include mathematics, programming in R and Python. If you go and have a look at Seek and you look at some of the programming skills that they're asking for, you will start to see the emergence of R and Python in the data science area. Biostatistical theory and modeling, really important to understand that biostatistical theory. Data wrangling, visualization, how we communicate, visualization, and machine learning. So the School of Public Health and Preventive Medicine at Monash, they have the health element and we're the coordinators. This course is a collaboration of 3 Monash domains, and they're leading experts in their fields. And we pull together the Faculty of IT at Monash and the Faculty of Business and Economics at Monash. And what you get is the result is a supercharged master's degree covering all those areas to meet the needs, the growing needs in the marketplace. You are going to leave this course with advanced expertise in health and data systems and programming, machine learning algorithms, biostatistics, data wrangling, and epidemiology. You will gain expertise and competence in key aspects of health data analytics, including professional practice. And you are able to specialize in biostatistics or machine learning, or you might just want to do a general stream in the health data analytics course. So this course is on campus at the Alfred Hospital and the Clayton campus. It's offered full-time and part-time. It involves a blend of online and in-person learning. It's a 2-year full-time course, a 4-year part-time course. And we're very excited because it's starting February next year, 2022. I'm going to hand this over to Andrew now to discuss the course outline and go from here.
Yeah, thanks very much, Jo. Just in terms of the location there, said Alfred Hospital and Clayton campus, but we're scheduling it so that you won't need to be at both campuses on the same day. So it might be some days your studies will be, your subject will be at Clayton and sometimes at the Alfred. So I'll just give you a brief overview of the outline of the course. So this diagram on this slide is it's split up into 3 different colors. There's the light blue, the medium blue, and the dark blue. There it's called Part A, Part B, and Part C of the course. So part A is really the core coursework that all students do, and then part B and C are when you can start moving into different choices of electives units. So in part A, there are 8 units, and Joe's essentially covered it, but the specific units are, there's an overall broad introduction to health data analytics, which is sort of going to be a preview of all the health data sources and the various um, statistical and machine learning methods that are used throughout the course. So this intro course is like an overview of the sort of the health data analytics arena. Then there's a very specific class about learning programming fundamentals in Python. There's a unit which is called Mathematical Foundations for Biostatistics. It's really sort of the essential biostatistical theory, not heavy duty theory, but there is a bit of maths involved in that. And then the unit on the right-hand side there, ETC 5510, Intro to Data Analysis, that's really learning skills in the R software package and then utilizing it in practice with data analysis of various forms. Then in the second semester, so this is designed for a full-time student who does 4 subjects per semester. Then the second semester, there's introductory epidemiology. Then there's another statistical unit about statistical inference. That's statistical tests, confidence intervals, p-values, etc. And then a unit about regression modeling, sort of statistical regression modeling. And also a unit conducted in Python about data wrangling. So I mentioned specifically about Python that some subjects will be done in R and some in Python, because it's really important that you have skills, graduates come out with skills in both packages. Then in the second year, there are two compulsory subjects. One is really human health and disease, which is really learning about the human body and disease systems, basics of anatomy and physiology. And the second one is a choice of 2 different units, which are both introductions to machine learning, and have got similar content, and you're free to choose one or the other. Then in the second semester of second year, there's a unit, a standard unit that's across all postgraduate coursework programs in our school, called Professional Practice Development. That's about organizational skills, working in teams, a bit of conflict resolution. So it's really about working professionally in the health arena. And then the other second unit in the sort of medium blue shade is the practical project unit. So there's choices there. So between doing an actual practical project or working at most likely group work in on a sort of big data in health type project. And then the blue units, the Part C units, they're elective units. And I do emphasize that the course code for this course is M6036. So you could just search M6036 in Google, Monash M6036, and you'll get the full information about this course. So next slide, please, Joe. I've got a question coming in chat. That's great. We'll come to that. We'll come to that shortly at the end. We won't be too much longer with this presentation. Thanks. So there are for the elective choices. Maybe could you go back to the previous slide for a moment, Joe, just to see. So the elective choices. So these are all in the dark blue areas. Okay, back to. So there's elective choices in various areas of sort of called advanced statistics or advanced biostatistics. I won't go in describing the individual ones, but there's also elective choices in the machine learning area, and that includes areas like natural language processing, which is analysis of text-based data rather than analysis of numbers, and deep learning, which can be used in, say, image processing, sort of machine learning algorithms for reading X-rays, for example. So there's a whole area in machine learning that's possible. And then some communication skills if you wish to really specialize in uh, developing visual displays for large data sets and creating sort of nice front ends that you can then show the non-quantitative people what's happening in your data with a nice visual display. So the requirements for the course, you need to have an undergraduate degree with an average of 60%. There are some English language requirements which I won't go through there, but we're expecting students, as Joe mentioned, so students might come from a health background and really want to learn more about the quantitative and particularly sort of machine learning and analytics aspects, or students may have more of a sort of statistics background or a maths background, where they'll pick up both the analytics and the health, or students may have more of an IT based background or computer science background, which you'll pick up more statistics and certainly the health focus. So it's almost no matter which background you come from, there could be credit for prior study that's going to be available to it. So you won't have to study subjects that you've already studied already previously. And so that means the master's degree can be a little bit shorter. Yeah, thanks, Joe. Okay, and in summary, so upon completion of this degree, you'll have obtained highly sought after skills to enter the work domain of health data analytics. And you'll come out with a very relevant postgraduate qualification with a combination of public health statistics, data analytics, epidemiology skills, and with a major focus on quantitative research methods. You'll have an advanced conceptual and analytical skills with a strong knowledge of research and statistical methodologies, and experience in the analysis and interpretation of health data. And very importantly, and really what lots of employers are looking for, you'll have experience in the use of both R and Python quite extensively, and have good written and communication skills. So, in summary there, this course is really tailored towards what's really needed in this emerging area of sort of the emergence of having huge amounts of data in the health arena, whether that's in private industry, whether that's in government, or whether that's in sort of the academic area. There are great opportunities in this area, and that's why we've developed this course. So again, I've just put a link to more information about the course, and I'll hand back to Joe, and then we can start taking questions. So thanks very much, everyone.
Thanks. Okay. Well, I don't really have anything else to say. So I suppose I'll stop sharing and we'll answer some of the questions. Well, there's only one, and if there are any others, I'll just put on hopefully my video so that people can see me again. What was the question in chat? Let's have a look. So, would you mind if I ask what kind of person would be suitable for a career in health data?
Do you want to read it out, Joe?
Yeah, I'm just having. Thank you for the very useful information. Would you mind if I ask what kind of person would be suitable for a career in health data analytics? That's an excellent question. Also, so I'll answer the first question. We'll answer that first. Andrew, do you want to?
No, you want to go ahead with that?
Yep.
Yes.
Okay.
And I'll grab the second one. Yes.
I think the sort of person suitable for a career in health data analytics needs to who's interested in the health domain. That's a very important aspect. Has a desire to make a difference, and also has strong skills in quantitative analysis. I mean, we'll develop it, but they'll need it to want to go into that data science area with a health bend. Andrew, you can expand on that as well, I suppose.
Yeah, that's right. And also, touch in, I guess you're saying you've got a health related degree there, so credit for prior learning in that. And I'll just sort of try and link these two together. So with a health related background, depending on what units you've covered, so you wouldn't need to study the human health and disease subject, assuming that some sort of similar anatomy, physiology subject you've studied as part of a health related degree, which typically would be, and would be fairly flexible about those sorts of units. And depending if you've studied epidemiology in some form as well. So there's certainly 2 units, and we can see, depending, it's very difficult to give a definitive answer, but it's at least 2 units credit that would be most likely here. And then just tying that back to what kind of person they're. So someone coming from a health background then has got an incredible advantage moving into the health data analytics, because one of the main criticisms of people emerging from data science degrees at the moment and moving into the health area, that they don't have any understanding of health. And this is from experience working with the health researchers who then engage the data science students who've got the purely technical skills but don't have the health application focus. And then they have to learn, students wouldn't know a lung from a liver, for example. And then so it's very difficult to explain the actual data problems that are there to be solved in language that a student can
Andrew's breaking
understand.
up a bit.
Okay.
Yeah,
I'll go a bit slower.
I can give you a personal. I can give you a situation. I'm working with a couple. I'm collaborating, as I said, with the IT department, and the students are really strong on and we're looking at fractures and AI with that, and they're really strong on the mathematical side, but the learning curve, we have to first get them into the health space, and that takes time. And once you've done this course, that's already there, so you can slip in straight away into those sorts of roles without having to learn, as Andrew said. That's a huge benefit. Are there any CSPs available for this course?
Oh, sorry, there was one last component there. How much of the available jobs in health data analytics are actually entry level? Joe showed a snippet of jobs, so some were entry level there and some were more senior level. But I think anytime there are senior level positions, they'll be looking for entry level positions to be working under them, because they're typically the senior level person will be guiding a team of junior people.
And I must say, I get people emailing me asking me, do I know of anybody, external organisations, colleagues of mine that have moved out, saying, do you know anybody that's got those sorts of, I'm starting to get those, and I don't know anybody. I suspect it's growing, as Seek has said, and COVID's just accentuated it because of awareness.
But it's something we're working on, but it won't be available for next year, I'm afraid. So I'm sorry, the answer's no for that. Yes, we will certainly be publicising it if that changes, and I'll be communicating that this came up at this information session today as well. But Monash has a fairly blanket policy on that. So there's, the Master of Nursing degree they really wanted to promote, but then as a specialist whole discipline there, so they use that. But apart from nursing, there isn't. Another question from Jeanette.
It's more
Student
about
biomedical sciences.
So Jeanette's interested in opportunities of interning, shadowing under health analytics researchers. Would you mind letting? Yeah, okay.
So certainly, what would be? Okay, well, it sounds like. Oh, you've got biomed and programming, learning R and Python. Oh, that's superb background there. So
yeah,
going into this course, there's possibility of working over summer with just in a research unit in our school. I think people would love to have. We have a whole summer internship program in our school. We haven't had any students in health analytics doing that. These students typically have got sort of a health background working in an area, but we've certainly got the possibility to be be having sort of summer internship programs for students in this course. I think that's a great opportunity. And actually, thanks for
I
that
actually have a
suggestion to
master's,
be.
Andrew. I've got.
Go
Sorry,
ahead,
you
Joe.
broke up. I missed it. Sorry. I've got a master's student who's in IT that is actually going into that scholarship. So they're starting to look more and more. He's in the healthcare one that you're talking about. So that further, to me, shows that, you know, desire of you know, the competing interests of IT and health. It's
Send an email to. We got our email addresses on those slides?
I don't think so.
I don't know. Can you pop them in the chat then, Joe?
Mm-hmm.
Yeah. So just send an email to both of us. Able to reach out to, absolutely reach out to us for questions. Yeah, I'm sorry we
Yeah.
we neglected to put our information on the slide. Yes, yes,
I've just put it in
please.
chat.
Yeah, please. Please email both of us with that. We'd absolutely love to answer any questions. This being the first intake of students
Yeah,
for this course, that we really like to hear from students.
absolutely.
Yeah.
Okay, thank you so much for your help. I will definitely reach out to both of you to ask further about that unit. It sounds really interesting.
Okay, fantastic.
That's
Thanks,
great.
Jeanette.
Yeah.
Okay, anyone with any other questions? We'll stay here for a little bit in case they're sort of rumbling around in your mind there, but stay on. Happy to stay on for.
Yeah, absolutely.
I was wondering what working in this kind of role looked like. Like, is it mostly desk work with meetings through the day? Is like, what aspect of this is going to be having at the Alfred Hospital? Because I wouldn't have necessarily expected that from a data analytics course. Like, even if it has that health part in it.
Are you asking at a hospital what it would look like, Andrea?
Like, as we move out of the masters at the end of the masters, what would we be expecting our day-to-day work to look like?
That really depends on where you go, right? I mean, academia is one area where you'd be doing projects, big data projects. I mean, I work a lot on linked data, and we do linkages with, you know, we work with organisations like the TAC. We do lots of linked data with government. In a commercial world, it depends on the organisation. If you look at that AI health company, and you know, I encourage you to have a good look at some of the what's going on in the commercial world. You'd be looking at big data and investigating large data sets in the health element. Hospitals have large administrative data. And they're doing more and more in the research and interrogating those. Andrew, what else do you think?
So could you? Yeah, I was looking. So you're talking about when you're in the workforce, what will day-to-day work look like? Is that correct?
Yeah.
As a graduate of this degree.
Yes. Yeah.
Yes. So it still would be largely office-based type job, where all the day-to-day work would be sort of sitting in front of your laptop, but there'd be a lot of in-person meetings with with sort of the data custodians or the people driving the research questions. But as you get more and more up the ladder, I would say you'd start get into the more other aspects of driving the research questions yourself, and then be managing other stuff. So you get more meetings and less doing stuff yourself. So it'd be the sort of typical corporate ladder. You'd come in at the level I would expect a master's graduate would come in at the initial level, where you'd be mostly doing all the work under direction from others. But as you move up, you'd start moving to more meetings and less doing. So it depends on your own personal preferences there. But it would be a combination. It'd be sort of like the work that so I worked in the pharmaceutical industry previously before coming to Monash University, and that's exactly how it was. It was working on specific tasks where you spend a lot of time at your at your PC, working
In
out
teams, though, as well. Yeah.
what needs to be done. Yeah, and we certainly have in the pharmaceutical industry, and then,
Yeah, it does in the other commercial.
that's right. Yeah, so there's teams, and people in teams have got different allocated roles. Everyone completes their role. Sort of, they work their bits independently, and then get together back as a team. You have team meetings, maybe weekly team meetings, and then talk about where the project's going next, where things go next. So we'd be covering a lot of that in the professional practice unit in the course about the skills needed in that sort of environment. But that would be typical in any kind of data science analytics role, I think. Just here we'd have a health focus. And the difference, I think, with the health focus is that there'd be the expectation that the health data analyst has got the background to really get integrated into the health question itself, really understand the health question, as opposed to just having a set of
Yep,
technical
not just
skills
looking at
to
the
blow.
numbers as numbers.
Yeah, that's right.
Absolutely.
And that's how our course really differs from say other data science type courses, where it's really just focused on the technical skills without much on the skills needed to work in a workplace. Because we've got the advantages, we've got the health focus, so we've targeted coursework to say, when you go out into the health workforce, you're going to need these particular skills, and therefore we'll provide that as part of the training.
And can I say that I when I'm talking, when I'm doing work with, say, for example, fractures, I'm talking to orthopedic surgeons, and I've actually gone in there and they've sat down and they've shown me, I haven't seen any operations because I'm a bit queasy person, but, they've gone to explain and they've shown me their systems. And so you're talking to these health professionals to find out. So your liaison, even at an earlier level, you need to understand. I mean, it's really quite exciting. I always find that really interesting, Andrea.
Yeah.
So
like knowing enough of the language that's required so that you can talk to the professionals and they can not have to dumb it all back down to plain English. Yep, that makes sense. I'll definitely have a think about it. I'll send you guys an email later. Thank you.
Thanks so much,
Pleasure.
Andrea. Thank you very much, everyone, for coming along to this session. And if anyone has any questions, then please do email us, and please check out the M6036 for more information about the course. So thanks very much, and bye for now.
Bye. Thank you.